demonstrate the movement. We, at some point in the first week of May, we thought we are moving on an average of 40 per day in terms of infection. But we had a jump. If you look at our days on your first week of May being the 7 days transition period from the level 5 easing to level 4 stage. But you see the actually exponential growth from the 7 that has actually taken us up to 148 on the 12th. Yesterday we dropped again by 30 in terms of the results that came through our labs. So May, our labs. So May has been giving us those kind of mixed feelings in terms of what is happening around us. Part of our outbreaks, President, have been actually happening in the correctional services centers. I must say we've worked with the Minister of Correctional Services. He has been with us on the ground, particularly in East London, BCM Center. Even though we had a situation in Sada, the outbreak in Sada, that is the Queenstown area, as well as a few cases that were registered here at St. Albans in Port Elizabeth. In the province, we've got about 45 of those correctional centers with about 20,000 population. The approved population is about 13,000 that is supposed to be in those correctional centers. The overcrowding is above 150%. Number of inmates to be released is about 1.7 in terms of the intervention that is being made nationally. We have tested about 2,800 inmates with about 1,156 officials in those centers. We found about 181 positive cases on inmates, as well as 52 from officials. The number of isolations or quarantines with the Department of Correctional Services, for their own arrangement, they've quarantined the first cohort of the affected or infected group. There, particularly the officials, they've worked within their cells to create space in terms of social distancing. They do have a capacity around Namakwe, closer to Baraweth, that they were also identifying to work on that. With their guest house being made available, as well as the 250 bed space in the Tata Remand Center. The number of recoveries is about 59, made up of 40 by inmates and 19 of the officials. They've had about 2 deaths, even though they were also caused by other medical conditions. The key interlinking strategy thrust of our campaign, President, is actually anchored on the following. One, the containing of the virus. We now, President, agreed that we should be focusing more on mass education. Ikhona President engathi abantu abakayiqondi ncam le virus ubungozi bayo, because xa unayo awuguli amaxesha amaninzi. Many people who are infected are not really sick. But also we've worked on the awareness screening, and we've already screened, President, more than 1 million people, targeted testing, and the general containment of the virus through the contact tracing, quarantine, and isolation. This is what we are currently doing, President, where we find people screen, test those who are PUIs, isolate, and also quarantine those who must be quarantined. We were even, at some point, President thought that we needed to be more preventative on our approach. We were going for a primary healthcare approach when we were trying to close our cross-border areas, particularly on the route that is between us and Western Cape. We are aware, President, that has almost put a lot of pressure in the national strategy, because that's not how the national strategy is designed. We were more aggressive on the primary approach, because we felt that if we allow these people suspected that they are getting into our communities, we might find it difficult to control the virus. This is where we have picked up a lot of numbers, and that we'll be speaking about at a later stage. The second one, President, is to focus on protecting the vulnerable by providing water and sanitation, shelter for the homeless, welfare and psychosocial services. Third one, saving the provincial economy and securing the future. The economic the economic recovery plan, skills development, education, and sustainable food security. The fourth one being sustainable solution, investment on health services, facilities, and sustainable infrastructure. Our strategy, President, is anchored on these pillars, being health and human settlement, infrastructure and the basic service provision, economic recovery, social development, and the local government coordination through DDM, education and safety and security, technically assisted by the following streams: the communication, data management, business continuity. From just very, President, and institutional arrangement, we do, President, have a very robust functioning provincial command council that meets regularly on Fridays at 2. We have extended that, President, into the expanded or extended provincial command council, where we are inviting the entire civil society, the political parties represented in our legislature, the religious community, the traditional communities, all of them meeting under one roof, visual, on Sundays afternoon. That's the structure, President, that summarizes that. We have taken it down, President, to the district command, led by executive mayors, to the local command, led by the local mayors, down to a ward-based arrangement. We do have our own Operation Maspatisane, plan that seeks to help us to work on a social compact and work with our people on the ground through our ward war rooms. So the structure indicates how we function as a province, and it has been working very well, President, I must say, so far, with all our work streams and Operation Kaweza, PMO, with everyone, HODs being hard at work in doing their work. On education, President, we are doing some work in line with the national coordinated approach. We're trying to neatly dovetail into what the national minister is working on in terms of preparing ourselves. Currently, we are working with our grade 12s, President, even during this time, to ensure that they are not left out in case they are expected to write exams. Since the lockdown period, they've been engaged through the broadcast lessons that are being done visual, through the community radio stations, covering almost 80,000 of our grade 12. So about 80,000 grade 12s, President, in this academic year. The schools are accommodating social distancing. The work that has been done so far out of 499 schools shows that We are actually ready for grade 7 in case we could be, or the decision will be made that schools must go back. The state of readiness is relatively present in the situation where we are in, especially with the province that has got a huge infrastructure backlog. But also on grade 12's president, we've got about 468 schools that have been prepared to be ready for that eventuality. On water and sanitation, we understand the bulk of our schools are not in townships. Yes, there are many in townships, but they are in rural areas where you're still battling with issues of water and sanitation. And the schools in need of water tanks are about 3,358. We are working on the procurement of that to ensure that that is being done. The delay was that it was nationalized at some point. It tended to be devolved to provinces so that province can move with speed. So we are attending to that as a province. And schools that need sanitation are about 2,500. Of this number, 79 are completed and 146 are under construction. Ongoing through infrastructure initiative, sanitation, appropriate for education and education infrastructure grant. We still appreciative, President, of the ASIDI program because of the backlog that we have as this province, the program of eradicating mud schools. Actually, this province, President, you need a lot of such national intervention. You need a sort of ASIDI in the healthcare facility. You need a sort of ASIDI in the road infrastructure, because you can't talk the connectivity in the province in terms of the economic development without talking that infrastructure. That includes roads, that includes your broadband to increase our bandwidth of doing business. The issues of PPE and higher education are being worked on. The process of procuring that is being worked out. President, the issue of scholar transport plans is in place as we are looking at this phased-in approach. The unfortunate part, President, is that even in the past, we were not transporting all kids that needed to be transported in the Eastern Cape. We're about more than 130 that were supposed to be transported, but we're just transporting less than 100,000 because of money that is available. So we've been working on that and increasing it annually when the fiscus permit us to do so. So under that kind of a very tight fiscal arrangement, we've been doing our level best to ensure that. On safety and security, President, the provincial plan crafted under the auspices of the Prof Joints is in place. And I must say that the men in blue, men and women in blue, have actually done exceptionally well, President, under the circumstances. I think they've actually served our people. It's very unfortunate that in the process of us getting involved on the ground, some had to be caught up with this virus, including the provincial commissioner. She's now in the isolation at home. But she's doing very well, President. I check up every day, how is she doing? So the team has been very committed, doing exceptional work, working with the South African National Defence Force in trying to help us to enforce regulations. The multi-departmental approach report, President, during level 4, 71,360 vehicles were stopped and searched on level 5 lockdown, and 92,467 were stopped and searched. At the same time, Mr. President, same period, 133,850 persons were screened and at the roadblocks, which are also health checkpoints, whilst 158,000 people were screened during level 5. A total of 1,501 cases were opened during level 5 lockdown. These are including a lot of the the wrongdoing, President, gender-based violence, break-ins. We had a situation of these break-ins even for schools. At some point, we had about 75 schools that suffered this. But police have been doing very well to follow up and deal with such kind of situation. On the provision of beds for COVID-19, President, the progress is reported as such. More beds are incrementally being made available to the Western region on order to respond to the epicenter demands for beds. That shows the graph or the template there indicates how those beds are actually spread across. An investment, President, of about 50 million is targeted to improve about 29 health care facilities. As I'm speaking, that work is being done to prepare those health care facilities for any eventuality. A further 3 million is being invested into the hospitality sector in order to support the program of quarantining. An additional 100 beds at an estimated cost of 251 million will be provided. The total beds planned, President, is 2,646. Total available is 1,300. Planned isolations is 2,481. Available isolation is 1,100. Planned ICU is 155. And available as ICU is 47. These are planned by the President because most of our healthcare facilities had no capacity to deal with this. So part of the legacy of this COVID-19 that is going to leave us with will be getting our people having an access to high care and as well as the ICU beds that were not there in the past in numbers that correspond to the population of our people who are in need. On human settlement, President, our plan and the progress on Buffalo City, the serviced land available for reblocking is targeted for 2,500 units. Land to be provided with temporal basic services is for 1,174 units. Land with decaying infrastructure that has passed its design life cycle is for 5,200 units. Land with bulk infrastructure is for 11,000 units. Service land available for reblocking is for 1,000 units. Land with decaying infrastructure that has passed its design life cycle is for 30,000 units. And land with with no bulk infrastructure is for 6,000 units. That is now under Nelson Mandela. And land to be provided with temporal basic services is for 1,000 units. Some good work is being done on that, President, in here in Nelson Mandela. It's just that because of time, we thought probably we can have that time for you to see part of that where we are also relocating people into that space. But our temporal shelter kind of an arrangement in response to this densification program was not to do it for the sake of doing it, but link it to a sustainable way so that we don't just burn millions of rents into this. After 6 months, we are expected that people must be relocated and we are not ready at that time. Provision of water tanks to programs in distress to support hygiene protocols. A total of 5,284 tanks have been allocated to the province, President, by Department of Water Affairs or Water and Sanitation. And rainwater, and 5,239 of these tanks have been delivered to date at 99.1%. Our entity has worked very well there, President, to ensure that we are on target and we're on time with this. We really need, President, this was, we can't keep on telling people to wash their hands regularly when they don't have water to access in terms of that serious compliance, which we believe that it helps a lot to minimize chances of our people spreading the virus. In Nelson Mandela, Nelson Mandela is above 83, and 83 out of 100 installations. Informal settlement have been more than 83%, 620 out of 744 installations. Boreholes, 320 are targeted for completion by 2020. I just wanted to highlight Nelson Mandela President because this also finds us at a time when we're grappling with drought. As we speak, we are nearing day zero in Nelson Mandela. There's never been a rain. We have a lot of rain on the other side, but the disaster is still hitting hard. The dam levels are very low that are supplying Nelson Mandela. It's another disaster in waiting that we are working on, but the Department of Water Affairs is working on that to bring about some interim relief and mitigation to address that. On social development, President, the challenge that we have of providing shelters and support for homeless people. All 7 districts are implementing temporary shelters to homeless, and a total of 18 shelters are in operation, and these benefited up to 760 homeless, and in Nelson Mandela, 258 have benefited from the shelters. The SASA, Department of Social Development, municipalities, and NGOs are providing social relief of food parcels and vouchers to distressed communities. The SASA delivered food parcels to about 32,000 households. Rate hovering about 47%, with more than 1 million people unemployed. So it's a huge challenge. SASA and social development combined can only cover about 40,000 households. So you have about 360,000 households that are not covered on these issues of food parcels. So it's a huge gap that we're dealing with as a province. That's why there's also a lot of issues and challenges about food parcels out there, but everyone is looking to get a food parcel. So we're trying to reprioritize our budget as a province, try to find money, assist where possible, but it's not an easy thing because the whole issue of COVID-19 disaster, President, has seriously eroded our fiscal baseline. So that challenge is not an easy one to manage, but we're trying our level best to deal with that. On the economy, President, in the 4th quarter of 2019, the number of employed people in the Eastern Cape was about 1.3 million. Formally employed amounted to about 834,000, which accounts for 60%. Informal employment amounted to about 24%, that is 344,000 of the total employment. Agriculture accounted for 5.5% of total employment, and private households 9.3%. Formal employment in the Eastern Cape increased from 788,000 in the 4th quarter of 2009 to an estimated 834,000 in the 4th quarter of 2019. However, total employment decreased between 2019 3rd quarter and the 4th quarter of 2019 as some business closed and some not functioning as business as usual. It is expected that employment will decline, especially in the informal segment. In the 4th quarter of 2019, the labor force participation rate in the Eastern Cape was 53.1%. This is an increase compared to 44.2% recorded in the 4th quarter of 2009. The unemployment rate increased for 2 consecutive quarters from 35% in 2019 2nd quarter to 36.5% in the third quarter of 2009, reaching 39.5% in 2019 fourth quarter. This indicates that the individual actively looking for employment were struggling to find jobs in the province. The number of the discouraged workers also declined between the first quarter of 2019 and the fourth quarter of 2019. The gap between the labor force participation rate and the unemployment rate decreased, which indicates a negative outlook for the employment within the province. That's the graph, President, just indicates that the unavoidable economic decline is expected due to the COVID-19, and as a province, we are always going below the national average. That simply explains that. The implications of COVID-19 for Eastern Cape, President, the Eastern Cape economic indicators by sector, that shows the same almost issue that I was trying to explain in a very narrative way, but here we're putting it in tables just to show per sector, the agriculture, forestry, and fishing, indicating that challenge of decline moving forward, but also putting up some projection as we move towards 2021. We're putting all those kind of projections and the current situation as we now talking to you. The purpose of this one, the President, is just to further explain the kind of work that we are intending doing using the current resources that we have, our provincial job stimulus package in time to revive the economies. What we also, President, said when we were establishing our provincial economic commission was that this challenge of COVID-19 presents us with an opportunity to turn around the economy of the province. If you look at the issues of the manufacturing, the textile industry, to be specific, the agriculture, with a huge arable of land that we have, we should not really be contributing at about 5.5% in terms of the economic growth in the province, in the agriculture. So we are putting all those measures in place, President, to assist those businesses, a number of them, in terms of progress, assisting business enterprise, being approved, and in terms of helping them to get back into businesses, creating jobs, etc. So that's work in progress that we're doing in that space. We also have other mechanisms like your local and regional economic development fund that targets SMMEs, especially youth, to ensure that they are supported with all the innovations that they are bringing forward. We also have the Isikalo Youth Fund that we're putting it at 25 million annually, also to support those young entrepreneurs out there. President, this is a very important slide for the Eastern Cape. When we talk agriculture, we just need 1 billion, President, for now. We need a couple of billions moving forward. But for now, President, because if we can activate these irrigation schemes, this is how people sometimes, like say these things. These were very functioning under the Homeland government. They do have infrastructure with them. Most of them, they've got their huge bulk water supply and a huge savings arable land. We've just tried to put this slide in terms of work that has been done, and they can contribute, coming into this equation of food supply. Heavy, President, if you look at your Noha irrigation scheme, your Kamata, etc., because they have this capability to help us, but they've been defunct, and we're looking at revitalizing them, getting them back into the economic space to help us. So, President, as you go back, I know we've got discussion with the Minister around these issues, Minister Diza, but the Eastern Cape, if you can work around this, because we're building our development around agriculture. We have said in terms of our 2030 vision, agriculture is key. We should be a food basket of the country. This is where you have got cattle, where you have got sheep, this is where, so this is where you have got land. That land is not safe. So we're looking for national government to come and look at that as a serious opportunity to help us move forward. Yes, of course, support that by having on the manufacturing and the OEMs, etc. But agriculture is key. It talks to our people where they are. It talks to the rural development, because our people don't have to move into these other industrial areas. They can work where they are. So we think that, President, this is a low-hanging, it's a quick win that we can work on and get ourselves better in moving forward. President, on local government, the progress has been actually made all metros, districts, and local governments functional structures, vibrant campaigning and cascaded structures in most towns, as I've indicated in our structure, as how we work. So we are handling this matter in the context of district development model to ensure that we get things done better and better. I don't think I must waste much time there. On partnership, President, we must appreciate the private sector. The private sector has been coming handy in supporting us. The MEC for Copter, President, is whispering to me that I must say something about Maspatisa. I've already said something earlier, that's how the issues of social compact, that's how we are working with our people, because our belief is that no state will be able to deal with this issue in terms of mass mobilization around it, but we need to work through our war rooms. Luckily, Satu came forward to say we are teachers. What we know best is to teach. Now that we are not teaching and we are getting ourselves staying at home because of COVID, we are prepared to go out and teach our people on the awareness programs. So we really appreciated that gesture from the SATU in the province. So we're working on that, President, to get all those volunteers helping our people, make our people understand this. But that's at least, President, of the private sector intervention. Where we are, I think there's a word here that the local business chamber here in Nelson Mandela has done. Has renovated. I think that word has already admitted patients already as we speak, over and above the facilitation that they've done with Volkswagen, investing about 135 million. You'll be coming back, President, to hand over in 4 or 5 weeks. You'll be coming back to hand over that. They are also helping us with the stadium here, the field hospital. They have donated a lot of beds there. Also our sister provinces elsewhere in the world that we have got twinning agreements, Zhejiang in China, we have a good relation with them. They are donating a lot of the consignment to our province. We have received the first one. We are expecting the additional 2 more coming, ISOs, giving us warehouse here in Port Elizabeth, where every business person is actually donating, and be it sanitizer, whatever that people are donating, they are just going in that warehouse to donate and get registered. Universities, Nelson Mandela and Rose, actually all our universities, President, they've come forward, even seconded specialists, doctors, that must work with our teams as we are putting together in addressing this challenge. So I might not finish all of them, but all of them are there listed. Your multi-choice, coming in, your Mercedes-Benz. Of interest in this, they are also manufacturing ventilators. We are not looking to get ventilators being imported, Minister. Already Volkswagen is working on that here. When I was there, I saw it live, and Mercedes-Benz is also coming on that, that there will be manufacturing those ventilators and donating them to our facilities. I'm almost nearing the end, President. On strategic consideration, President, we request for additional support in provincial epicenters, Nelson Mandela, Buffalo City, Tristan, and OR Tambo, that have the highest number of confirmed COVID-19 cases. We're looking at human resources. Yes, we are aware that the Minister is giving us doctors, the team of the doctors from Cuba. But with the challenge that we have, we appreciate the number, Minister. As others decline, I think the more you recruit them this side, the better. Because on our primary healthcare approach, they will definitely fit well in the situation. We're looking at ramping up testing and also working on the field hospital. We've already gave Minister that request on the field hospitals. We over and above 4,000 field hospitals that Phosphate is working on. We intend establishing 500 beds field hospital per district out of our 8 districts. But we are thankful for the Nelson Mandela one, but we believe that because our province is very vast, so we are planning for bigger, because our target was 8,000 beds out of those additional field hospitals. On the economy, President, we request for funding towards the privatization of our irrigation schemes. That's indicated. Request for support to unlock investment for SOEs. Request for support to expedite process of a provincial application to the infrastructure fund. President. There are pan-times, they've changed their pan-times, which make things a little bit difficult. I think we can make another submission which is purely economically focused, where we think that how sometimes things are done nationally, this one size fits all, and it might not necessarily help us the way that we would need that help. Under local government, municipal relief fund to plug the revenue gap created by COVID-19, request support for bulk infrastructure in drought-stricken areas like Nelson Mandela. There's work being done. Let me acknowledge that, President. It's just that it was also delayed by this, because we've got water that we're getting from Orange River that is being taken down here. There's a bulk water scheme that is being worked out on that, but it has been delayed. But the challenging part here is the western side, that it talks about your Koha Dam, this other side. This is where our dam levels are very low, which affects not only Nelson Mandela but also the Sarabatman part in our province. The interprovincial collaboration support from national to manage interprovincial collaboration in the implementation of COVID-19 strategy. You are the President that yes, Western Cape nut. As people die in the Western Cape, many of them are buried here. And there are COVID-19 cases. We don't blame anyone, President, about that. It's our collective. We can't chase these people away. This is their home. If you consider the situation of Cape Town in winter, it's going to be raining and people are sick. The only comfort they have is to come back in their homes. They are in better situation than to be in the informal settlements in Western Cape. So we need national to come in there to work. We're working with the Western Cape, with the bilaterals, with the Premier and the team. We're talking on protocols on how best we can collaborate and find a solution. But we're even looking, President, this thing of transporting these cops from Western Cape. It's a risky situation. These people come, because we've picked up those positive numbers in those taxis that are bringing those people here as well. So that on its own, President, yeah, it needs a really national focus to help us to deal with this situation. President, thank you very much for the opportunity. I will ask Dr. Megashe not to be long, but just to zoom into our rapid response strategy on health, tackling certain areas. Dr. Megashe. Thank you very much, President. Just sanitize, yeah?
This one. Let's do this one how you dress. Ils ont sous-salé, défaqué. Yeah. This one.
Good morning, Mr. President, Honorable Minister, the Premier, the MECs. So let me restart again, Mr. President. Good morning, Mr. President, the Minister, the Premier, the Honorable MECs, and the guests and the colleagues. Mr. President, the Premier has covered most of the areas of the province. I am being asked to highlight the way how the province is responding to the epidemic. Also to highlight the contribution and the guidance from the Minister of how we've made some fundamental changes in our strategy in response to some of the high increases in our numbers. We have been briefed and been guided quite well. We understand our problem is not unique to ourselves. We also have to learn from other countries. So we've taken the lessons from the US, the Italy, and Spain, and we look for good lessons and approaches from South Korea. And we actually want to say to you, Mr. President, the lockdown has worked and our curve has been flattened. And we think because of that, we have given our health system in the Eastern Cape a better chance to survive. But the Minister said there are a lot of things we could do to make an improvement. We want to share that story with the President today of how we're going to respond to the urgency of our matter that's coming forward. At the bottom of the slide, Mr. President, we understood that if the lockdown was not successful, we would have heard the black graph at the bottom with a huge surge. And that would have crippled and overrun our hospitals and our healthcare services as we sit today. But that lockdown has pushed the curve down and really created us a space But the minister, when we spoke and he came down, he says, we still have to make sure that the crisis level of healthcare services in the Eastern Cape should still be worked very hard, because Nelson Mandela Bay, Chris Hani and Buffalo cities were growing much faster, and we're going to meet the similar situation like the Western Cape. So we needed to do some more work, and that work is going to be the ones that we are going to share with the President. The Minister has done some good work on modeling in terms of trying to tell us how should we look at the future as it actually evolves. We have two big futures. One of them is the optimistic, which is the blue line. The other one is the red or pink line. And in terms of these two futures, we had to choose the blue line. And we think that the lockdown and all the interventions, we will be able to achieve that. What that blue line says, our active cases are going to grow. And the blue line says, if we then have that optimistic, we anticipate that at the peak, we will have over 150,000 cases that are active cases. And that could change because of the variation within that. The hospitals that we're going to be requiring, those that do not need ICU, the Premier has really indicated to the President that we will still be, or if we are staying on the blue line, our hospital facilities will still be able to cope with our problem. But if we don't stay with the blue line and go for the red line, the hospital services will be in the surge. And when we look at the ICU, which is the most important area, Mr. President, that we're really, if you look at our line of the ICU, is right at the bottom. It is actually way below from the blue line as well. That is really the legacy of the services that we've been given in our province. So one of the things that we really feel that we're most exposed is the availabilities of the ICU beds for those patients that are severely ill. That will have an impact, Mr. President, on the cumulative death around the blue line. Because if we can't provide that support, we will probably be looking for the red line. From here, I'm going to move very fast. So what do we propose? The strategy for the province was saying there are probably good places where the lockdown, the staying at home, the washing of hands, the social distancing has done some good work and is actually showing that those can be protected. So we have a broader strategy of working within the job to stop the chain of transmission and prepare for the eventuality of the blue line. And then we are also saying there are places there where we could save and actually make sure that they are lower and with less risk. Joe Kali, Alfred Nzo, Amatole, and Sarah Bartman. We have now taken the new strategy, which really says target where the case is arising, follow the network of that case, and make sure that every person who is positive is then isolated. But make sure that those who are in that communities or those individuals, they actually provided a quarantine as well. And we needed to provide that. And that program, Mr. President, is really the new strategy that we're following. We are following every case, and we're going to demonstrate how that strategy is going to work. Where we feel that we have actually reached the community spread of the diseases is in Oa, Tambo, and Chris Hani. It has gone to villages and it's gone into communities. Again, there, we're taking the second aspect of the strategy. It is called, you get a communities, you screen that communities, you follow the people who are infected in the communities until the community has stabilized. And that is a mass targeted mass screening and targeted quarantining and making sure that we pull up the people and isolate. There are areas, the fourth areas that we have is the hotspot. This is the areas that we have now in BCM and Nelson Mandela. Here, we are going to be very reliant from the national program of lockdown, different levels of lockdown. But that does not have to be the totality of the center. It could be certain hotspots. This is where the strategy has also changed quite substantially. In the past, we used to put mobile teams that goes and look for problems and actually go to the next level. With the guidance of the ministers, we've created now what is called fixed teams that have epidemiologists, a specialist that actually stays. Those teams' responsibilities is to follow every patient and make sure they know exactly what happened to the patient. The journey of the patient is being PUI, tested, identified, kept in hospital, discharged, recovered. Those teams are going to do that. We have actually taken one additional strategy of really managing our borders because of realizing that there are problems in our borders. So this is really the strategy that's going to keep us in the blue line. Mr. President, we think we're going to need a lot of resources. The Premier has spoken to those resources. At the top, there's a red line. This is really the red line that shows that if we need to make sure that the deaths are not coming up, we need to have the critical capacities of the red line. In particular, the ICU and the number of beds that we have. The second level is really the beds that are really for non-very sick people that can still be there. We think we have sufficient numbers on those. The Premier was really raising some very important part that we're working with some of our private partners. They are developing a very unique respiratory machine. We asked the Premier to close the borders, Mr. President, so that when the machine is ready, nobody takes it from us. It's a machine that's going to be able to be used in an ordinary beds with a very simple, like the ambu bag, provide a positive oxygen, and that will bring the bigger capacities of our ordinary beds. And we're hopeful that machine is going to be much cheaper than machines that we're going to get in. So that partnership is going to make a huge difference in our contribution. Mr. President, the strategy then is really to try and make sure that we are dealing with the risk. We're looking at the elderly, we're looking at the people with comorbidities, we're looking at the people with compromised immunities. Those have been specialized. The Premier has put up a vaccine program. We're going to put a vaccine program for all elderly, and then we're also putting up a vaccine program for the healthcare workers. On the side of the keeping the transmission down, we're driving the social distancing. We're making sure that it is mandatory to quarantine a person who could infect other people, and we're making sure that the cleaning of hands, the social distancing, and the cough hygiene is maintained. At our hospitals, we anticipate that we're going to have 80% of the people asymptomatic. The Premier has actually designed that in Nelson Mandela we'll have 4,000 beds that are going to be able to take out these individuals and allow them in a very safe zone to be isolated. Every district is going to have at least 500 of these beds that are actually built to make sure that anyone who needs isolation is actually supported. We're creating in all our hospitals what is called a high volume triage. It means that the hospital now is going to be divided in two entities: the place for people with COVID and the people that were actually sick. We want to safeguard our sick people. And the last part, Mr. President, is that when we do all these, we still have to deal with an unfortunate problem. People will be bereaved and people will pass on. And we're working with many of our colleagues in the mortuary services, in the forensics, and undertakers to make sure that it is. How is this strategy going to be achieved? We have a well-developed strategy, Mr. President. It's called Masipatisane. Now, I practice this word very hard, Mr. President. I usually get a tongue-tied on the Masipatisane. But the Masipatisane is now the drive of really community-based strategy, which the Minister and the Premier have actually agreed that we are going to set up communities, we're going to activate people, we make sure that all structures in communities take a responsibility.
A COVID patient, positive patient, will no longer be a problem as simply of health people. The community will take responsibilities, look after the person, and make sure that the person is cared for. We're also worried about the issues of stigma, Mr. President, and we are worried about that because we want to make sure that people who come back to their communities are actually accepted. So the Masiphatisane approach is going to be very instrumental in stopping the curve. In the urban areas where we've got hotspots, we have actually starting to create using map system where we're putting these spots and create a geographic element. This is just an example of the Motherwell, which is a township near here, which is a hotspot. We have now mapped all those hotspots. The teams that are fixed now, they will go to each one of those hotspots, screen the individual, follow the person, isolate the person, quarantine, and if he needs hospital, he gets to a hospital. And Mr. President, this is just a snapshot of the epidemic in the province. In the big bubbles that are here, they are simply showing the number of the hotspots in different areas. Many of these hotspots are driven by what is called super infection in the hubs. And these super infections, they happen in funerals, shopping centers, and unfortunately with the SASA when people are looking for indolda. So it's something that we're talking with our colleagues at social development and actually making sure. We have found also, unfortunately, some of our private hospitals have had higher levels of epidemics, and these were actually followed. So we map them in that way, and we have these bubbles. As the bigger the bubbles, we know that the bigger the problem. Everyone in those bubbles is going to be traced, everyone in the contact is going to be found, and every person who's positive will be isolated. This is the Nelson Mandela. We're doing the same thing at Buffalo City. They have got a different patterns. This is more of a networks in Buffalo City, especially the correctional services. We're doing the same thing in OR Tambo, and we've got a number of villages. Again, funerals and traditional events are actually the drivers of the big transmission. And then in the Krisani, which is also growing up, here we're finding that where we work with communities, we're actually being able to really trace people better than ourselves on our own, because they know who is actually the neighbor whom they've worked with. And we're finding that is slowly helping us. Again, communities are very aware now of funerals, and they're actually being able to help us to identify people who were in the funerals. And the Premier says they must actually have a register. I don't know how good, how is that going to work, but the communities are actually helping us. And then we've got the 4 districts, which still has very small bubbles, but there are some or 2 bubbles that are coming up, and we're following those. Mr. President, then the last thing we wanted to show you the number of work that we're doing in order for the 20% of people that are going to need hospitals. Big work that has been done between ourselves and Public Works and through our joint command in trying to prepare for the hospitals. These are the hospitals in the different, what we've called regionalized areas. We group each areas of Nelson Mandela and Sarah Baartman, BCM, Amatole, Krishan, and Jograd. We know what hospitals we have. We know which ones are being renovated. We know when they're going to be on board. In total, we're looking for 202,826, what we call re-engineered and repurposed hospital beds. This is important for us because we realize that when we started the program around the COVID, we used to talk about PPE. You have heard, Mr. President, of all the big strikes that are happening. What we actually realized that people wanted to see a change in their hospitals before you can ask them to go and confront the big enemy. So our hospitals are being re-engineered, both in terms of the structure, the flow, the administration, and we are literally going to tag them. So every hospital bed, a ward that is for COVID, is going to have a COVID hospital. There will be a requirements for you to go there as if you're going to a theater. If you don't have this and this, you will not enter into those wards. We think that's going to make a huge difference in the way how we're doing this. This slide, Mr. President, is just to show you, in spite of the fact that we have huge problems in hospitals, our problem of admission is still at a reasonably low levels. As we speak, there are about 129 patients who are hospitalized in the totality of the 85,000 hospitals that we have. Some of them are there because they needed to be isolated, they couldn't be isolated anywhere. And many of them actually have recovered from a hospital admission. So of the 129, 28 have recovered. Unfortunately, we have had 16 deaths, most of them in our hospitals. We know that there could be deaths that we've missed that have not come to our hospitals. But what is really important is that we are now able to tell Mr. President where in each area, where are the patients. So on the pie graph, we can show that at Nelson Mandela, as we speak, we have about 35 beds in our hospitals here. You go to Krisani, we can tell how many. In OR Tambo, we can tell how many. And that gives us an opportunity to know exactly where to focus in terms of the resources that are actually required. When we started the program, we also knew that we're going to need additional people. So we started by having 1,000 unemployed nurses, and we rapidly employed them. We went for 1,000 general assistants, porters, and everyone to make sure that we're building up the capacities. We also work up to train for 2,000 of our nurses on the new ways how these are just a number of allocation of these individuals. We have to date, we've got about 826 of the 1,000. We think by end of the month we should get those. But we think we're going to need more people. And National has been working with us to try and really project what are really the projections of patient of numbers that we need to have. And in this way, we are also, the next big area is the PPE. Now, when we had a meeting with the minister, we said quite a lot and see how best can we really deal with the problem of the PPE. What has we found is that there is PPE in sufficient quantities. And as you know, Mr. President, as we've shown you, there are only 129 patients who are COVID positive. But we've got millions of items, and we understood why are people still saying there's no PPE. When the minister asked us, can you tell me right now, do you have sufficient PPE, yes or no? We couldn't answer that question because we had the PPE in the stores, and he says he's not interested in the PPE in the stores. He wants to know whether it's in the hospital. So the strategy now has changed. We have put boots into the hospitals to find the PPEs on a daily basis. And we've created a structure now that involves the CEO, the labor teams, the infection control people, the operational health and safety people to sit in one room to really look at the problem in their hospitals and give us daily numbers. And we're going to do our own auditing of that. And we've changed the strategy. We were the minister really showed that we have not done our work very well. So we didn't have a really dedicated people who deals with the forecasting. We have established that. We didn't have people, we had many people who were procuring. Some were procuring from the depots, some were procuring directly, and some of them were procuring from the unsolicited bids. We have now created a structure to do that. We also look at the logistics and the distributions of materials, and we're also looking for the rational use of the PPE. Unfortunately, Mr. President, the PPE has been not rationally being used. These are expensive items, and some of them, because they are very fancy, they go away. So we're putting new control system, and I think when we have created these wards that says you need a PPE to get here, people who are wearing wrong PPEs in the wrong ward, we can say you are in the wrong ward, go to the right ward for the PPE. So we're trying to control the PPE. The last part, Mr. President, is just to show how are we really are looking at how we really prepare for the PPEs. National has actually assisted us to use the actual healthcare workers to look in terms of how much PPEs do we use, the different types and items. In the second part, they say, look at the forecasting and see when are you going to reach your peak. So the graph there, in terms of these differences, they are showing the colors, the different types of the PPE. But if you look on that slide curve, it actually shows that when are we going to get the biggest demand. So June, July, and August is our peak months in terms of our projections. There we have to ramp up and make sure that we've got all the different items to make sure we're meeting that. And in terms of the items, these are the items that we have. And when we looked at these items, you will see that some of the items are green, some of them are actually yellow. So those that are yellow, they've got at least around 50% of the supplies that are actually required in terms of our projection. This now kickstarts what is called our early warning system, where we rather certainly know that there's a problem in that area, and we've got what is called a limited demand push system. Mr. President, these are some of the visuals of the different districts here in Nelson Mandela. Again, most of them now are green because we've been working with ourselves, with the team, and we're actually making sure that there's audit in hospitals, and these or occupational health committees that are going to be helping us. And then this is Duranginza is one of our hospitals. Again, it's got some yellow places. They've got the stock, but they are not in the levels that we want. And this is the Livingston Hospital. They've got some green areas, and there's some areas that are going to be requiring some more work. As we conclude, Mr. President, is that we think that the design that we have should cater for the people who need isolation. Our communities cannot self-isolate because of the densities where they live. We have to build these field hospitals, and our projection, we need a minimum of 8,000 of those. The second one is that these field hospitals are going to do more than the work that is a hospital. They are going to keep non-sick people in order to make sure that they recover in those 14 days. We are looking very closely that the current hospitals, with a little bit of technologies of ventilators and oxygenators, we can keep people and help people to go through the big hump of trying to recoveries. We have been using our laboratories very generously. We have now revised our strategy. We are only testing within the national guidelines because laboratories have been overloaded, and we're trying to deal with the backlog. So there's going to be a very strong rational use of our laboratory services. We think that we should be able to bring huge numbers of community health workers. At the moment, we've got about 5,000 community health workers. National says we must ramp up that to get to 10,000, because these are the people that are going to be our legs to actually find and actually assist us with it. We have been working on the logistics and the procurement of the critical COVID supplies. The issue here with us is that we did not have a visibility at a facility level. Those who have created that. We're getting here, Minister, around 20 post-pharmacy assistants that are going to be in the field. They're not going to come into the head office. They're going to go hospital to hospital, clinics to clinics to check the materials that's actually required. We have now created ourselves at the head office. We have totally been disrupted. I no longer have an office, Mr. President. I stay now in the boardroom because my office has been dismantled, because all of us are functioning in a very different way. We're functioning in teams. We have to be more agile. Everything has been done within 24 hours. We think that we should get more technology investment in our system and making sure that we're using technologies. We're speaking both for tracing. We're speaking with the giants to make sure that they are assisting us, and we think that we're going to be needing some new expertise, and we're really grateful to the Minister. We need now new type of people, data managers, data analysts, epidemiologists, engineers, and all that. Some of these people we have, and some of them I'm going to write a note to the Premier to actually ask you to give me those. Thank you, Mr. President.
Thank you very much, Dr. Bengache. I think we are on you now, and then after that it's going to be the President in terms of our program. Thank you so much. Come and sanitize. Minister Jackson Tim.
Excellency President Ramaphosa, Honorable Premier, MECs, the heads of department, colleagues, members of the media. I did promise Premier, listening to his language, it looks like after COVID-19 we'll give him an honorary medical degree. We are in a corner. President, when I was leaving the last briefing, the meeting took a resolution between the Premier, the MEC, and those officials that when the President comes, they'll silence the Minister. Now, they have silenced the Minister, I must say. President, this program is on the right track. The challenges that they were facing, I think everything came behind the line for quite a while. The infections took a bit longer to come here, and they found everybody not ready at all. Even the team was not quite coherent, but I must tell President, I'm listening here, and we always say when we have a discussion, it takes 5 minutes to know whether they're on the right track or not. This time around, President, I'm happy. I want to say, and we meet every now and again, so we know exactly what we're talking about. So the challenge here is that both in the West and the Eastern Cape, the epidemic is getting into a bit of an outbreak that's gonna get out of control if we don't change our strategy. This team has understood that. Listening to their plan, there are 4 things that I was concerned with. The first is their strategy. I'm happy now. The strategy is focused, the strategy is intervention, the strategy is directed to where we need to be going. Now we can go somewhere. And I want to say, I haven't done any calculations, but we need to look at June and July. We've either got to have an outbreak that is out of control, or an inflection. So with the approach we are taking, and we're going to expand to other areas, I think they're on the right track. So the intervention strategy, the second one was the issue of PPEs. Again, we couldn't go further than this discussion when it came to PPEs. They have now moved, and I'm happy the way they're dealing with it. I've seen some people marching outside. So the focus now on PPEs, I think, is taking us somewhere. They've got to keep that focus. The third one was human resources. You've just heard President, they've actually taken in the numbers. In the last month, the 1,000 professionals that the department is talking about is 2 to 3 weeks. They've actually increased as many and brought them in. So they want to focus on that, and I'm happy they've dealt with it. The fourth one was infrastructure. And I did say to the MEC, I wasn't quite convinced they were going to get there. They are getting there, President. And that's why I'm happy the President has come to see the readiness. Now the Premier has given the presentation, which is an all-government, multi-sectoral response. It's in line with the President's views. And so, President, I think it was, for me, a pleasure for the President to give you the presentation. Of course, now we've got a different judge to have a look at the issues. But I want to say to the Premier, MECs, and officials, this campaign is led by the Commander-in-Chief. And there's a clear line. We have to contain this outbreak. At the same time, we have to balance the saving of lives and saving of their livelihoods. That's what the President has said. And I like the fact that the President is not talking from a distance. He gets there, and this is why We're very pleased to welcome the President here today. The Cabinet knows when the President comes, he would like everybody to be focused on the issues. And his concern would be our people's lives are at stake. That's where we start. And so I want to take this opportunity to welcome President and invite President to come forth to make his address. Thank you very much. Even though I'm full-time, I'm not very degree.
You want me here? Yes. You don't want me? Okay. Thank you. Let's be seated. Ufuna ndiyifake futhi ndibonise ukuthi uyakwazi. Ndingakubonisa ukuthi ndiyakwazi ukuyifaka. Minister, Mkhize, Premier, MECs and officials of government here in the Eastern Cape. It is really a pleasure to have this opportunity to visit the province, particularly in the midst of dealing with COVID-19, but more importantly to come and hear the progress that you are making. From what I have heard, you are making fantastic progress. And I'm rather glad and in a way privileged to have this opportunity with Minister Mkhize to come and be at the ringside of listening to the full outline of the initiatives that you have embarked upon. I must say that I'm really impressed with the strategy that you have put in place, and I can see that the Eastern Cape is really awake. Nivugile, you are alive and awake and you are energized. Oh, you want me to? You want me to sit down or stand?
Just to hold.
Okay, just to hold it. I particularly like the full outline of your strategy as well as the pillars that support that strategy and the way that you've identified a number of elements of that strategy that are driving the intervention of the province to deal with COVID-19. And I also particularly like the institutional framework that you have put in place, that you have set up your own provincial coronavirus command council, but in your case it is broad. It is much broader than we have at national level, so it's something that we can learn from you because you've sought to involve a number of stakeholders, and stakeholders that you are working very well with and making sure that they become integrated in the work that is being done. And I think it is in this regard that you will be able to make the type of progress that Minister Mkhize was talking about. You're utilizing the district development model to approach the work that needs to be done in dealing with COVID-19 is also a huge boon as far as we are concerned. I'm really glad that you have embraced the district development model, because it is through this model that we are going to be able to ensure that we really get to grips with COVID-19 and lower that curve even more and more. We are going to be giving you ministers or deputy ministers who will be working with you in each of the districts that you have. Those ministers and deputy ministers will be continuously and daily engaged with you, working with you on an ongoing basis to make sure that whatever happens, whatever challenges that the province has, even at the lower level of the district has, we're then able to upgrade it, to uplift it to the national level. Immediately, Minister Mkhize will get to know. If it's the Minister of Education, they will get to know what's happening in the schools, in the district. If it is a police or security-related matter, the Minister of Police will immediately know what the challenges are. And if it is, for instance, a gender-based violence problem that has arisen as a result of dealing with COVID-19, it will immediately be escalated to the level where we are. So ministers and deputy ministers are now going to be deployed throughout the country as we now deal more effectively with COVID-19. So soon, Premier, you will be getting the names of the ministers or deputy ministers who will be allocated to your level. I also particularly liked to hear how you are ready to make interventions in another key area of attention or interventions that we have to make in education. As we're getting ready to get our children back to schools, firstly at the grade 12 level and the grade 7 level, I saw how you are getting ready and the number of challenges that you're also prepared to address. Now clearly, a number of the schools in the province have challenges in relation to, for instance, water and sanitation and infrastructure. And you have highlighted that. Your plan and your strategy highlights all this. And this is what I would call the silver lining that we also need to look at in dealing with COVID-19. What COVID-19 has been able to do for, I would say, government, and I would say also for the whole country, is that, one, it has made us come together as a nation. It has been able to enhance social cohesion amongst us, solidarity amongst us. Many South Africans are beginning to have a sense that they are proud to be South Africans because they can see that government is managing this disaster extremely well. And as we have often said, we are building this plane, and it's possibly better to say we're building this ship as we are sailing in choppy waters in the sea. We are building it, and as we are building the ship, we are moving forward with our people out of the dangerous waters. Now, as we are doing so, a lot of positive things are beginning to come to the fore. The one important thing is that government is beginning to work much more effectively. We've always said that the capacity of the state is one of the biggest challenges that we face. And as we are dealing with COVID-19, we can see how the capacity of the state is improving. And even as we are traversing uncharted waters, We are going where no government, and may I repeat, no government in the world has ever been to. Those are the waters that we are traversing. And sometimes there'll be missteps, but most of the time we're getting it right. We're getting it right to save our people's lives. And the capacity of the state has now come to the fore. We are beginning to do a lot of things in a much more purposeful way, more effectively. We're meeting much more regularly. And even as people would say, yes, we're not moving around, we're staying home. Staying at home has meant that we're spending lots of hours in meetings. I'm involved in meetings almost like 20 hours a day, 18 hours a day, and we are working much more harder and effectively. And the other positive is that I'm finding that ministers in the government, deputy ministers, are now working so well together in an integrated manner. And I can see that it is also happening in the province. From your report, you're telling us that you're meeting much more regularly, and I'm sure that that regular meeting process is enabling you to work more effectively together in a joined-up way. The other important thing that COVID-19 is yielding, which I can also see here, is that it is enabling government to work in an integrated way, where we begin to destroy and get rid of the silos. Because quite often in government, people build their own fiefdoms, they have their own silos, and dealing with this disaster has enabled us to destroy those silos, and we are now able to work more effectively together. But what it also has done is to enable us to look at the real serious challenges that our people are facing. The challenges of real crushing poverty that our people are subjected to, and has also evoked a more purposeful determination to deal with those challenges. What COVID-19 is now doing is building capacity in the state, enabling us to have much more greater determination, to be much more focused, and to do right by the people of South Africa, and to address those challenges. Now, I see that happening here as well. You've now identified the exact number of schools that need sanitation, exact number of schools that need water. And what that is leading us to is that COVID-19 is now leading us in the direction of saying we must provide water in those schools before the schools open. Because those schools should not open until there is water in those schools. And those schools should not also open until there's proper sanitation. So this is what COVID-19 is now unleashing. It is now upgrading the capability of the state, and it is now going to make us to act much faster. And we saw it right at the beginning. We spoke about it, that there's a challenge of water throughout the country. And Water and Sanitation Department then came into its own, and water started being provided. And our people are happy. And we are saying we dare not lose that capability, that focus beyond COVID-19. But we must do it right at the moment. So I'm delighted that here in the Eastern Cape, we now arrived at a moment when we are now going to upgrade the infrastructure in the schools that can be done now immediately, such as water, such as sanitation, and of course, we are also having to address social challenges that our people face. You have identified that there are more than 400,000 households that are below the poverty line, where there is poverty amongst us in the Eastern Cape, in those 400 or so thousand households. And that means that we as a government have got to respond. We've got to ensure that, yes, we meet this challenge. You are now expending your fiscal resources to meet this challenge, and you need the support that national government can give you. The other important thing that I appreciate with how you are looking at this COVID moment is how we can revitalize the economy of the Eastern Cape beyond COVID-19. And I think this is a really good approach to dealing with a pandemic. That's exactly what we are doing at national level. We are going on rather with the process of saying beyond COVID-19, the economy of our country is going to almost be a wasteland. And we therefore need to revitalize it, to rejuvenate it, to rebuild it. And as I've often said, it will almost be like a post-war situation. We therefore need to come up with clear strategies of what needs to be done. I'm delighted that here in the Eastern Cape, you are already looking at all that. You're looking at opportunities, not only to revitalize, but to transform and enhance the recovery of the economy. And you're looking at the key sectors, important sectors that will contribute to the economic life of the province. But you're also looking at it in a futuristic way. But more importantly for me is that you are looking at it in a much more detailed way, almost in a granular way. You have identified, for instance, in agriculture, particular interventions that need to be made in a number of areas that you have set out to get us to have a huge intervention. Yes, you say you want R1 billion for starters. Kwamati, you want many more billions. I can understand that. But it's in an area of agriculture where you want R1 billion to be invested for the irrigation processes, for the infrastructure that goes with that. But I like it also that you have identified the number of sort of crops or activities, be it cattle, crops and maize or whatever, where this revitalization will go to. What you have not been able to tell me and Minister Mkhize is the number of people who will be employed. I did not see it in your slide, because that is what I'm more interested in. Of course, we've got to rebuild the certain sectors of our economy, which I like, but I also want to know how many people are going to be employed. Post-COVID-19, the one thing that I am most interested in and concerned about is the number of people who will be unemployed. And I want more and more our people to be drawn into employment, and that is precisely the type of economic activity that we want to see. But I want to thank you for having identified this sector. And of course, there are quite a number of other sectors. The oceans economy beckons, the tourism that we need to open in your province, which has possibly the longest coastline in our country, is another area. Of course, the auto sector, which you are champions in, and the auto component sector, and a number of other sectors. You've identified the one, and there are many more that we need to pay attention to. And what I particularly like is that even in revitalizing the economy, you know that we cannot do it alone. The Eastern Cape, and indeed national, cannot revitalize the economy of our country alone. We have to act with other players. There are many, many players we have to act on. Yes, our usual social partners, but more importantly, the private sector will continue to play an important role. Labor will play an important role. On the health side, which Minister Mkhize responded to, the plan and the outlook that was outlined here is particularly pleasing. We've been very concerned at the national level about the rising number of infections that the Eastern Cape has been demonstrating or showing. Now, I'm particularly happy to hear that, yes, you have awoken to the danger of this, and you're now putting in place a clear health strategy that is going to address this challenge. And I think your health strategy, as also enunciated by Minister Mkhize, is the type that can work. You also say that the lockdown has worked, because from your own measurements, you have seen how that spike that was happening in the Eastern Cape has now been leveled, and the curve is coming down. And this is clear proof at a provincial level that indeed the lockdown has worked. And in our case, that's exactly what we are seeing at a national level. And our approach has been, we must save the lives of our people. But as we save lives, we must also save the livelihoods of our people. We must address the economic impact of coronavirus as well. Your health strategy, of course, is already manifesting itself in the screening that you've embarked on. You've almost screened, you say, 1 million people, and yes, that's what the figures tell us. And now you identify the areas where isolation needs to take place. You're also focusing on filled hospitals. Now, on filled hospitals, yes, I agree, we need to do that. But I think we should also use COVID-19 as another building block for the NHI. As you identify places where you've got to put down filled hospitals, make sure that you also look into the future, because filled hospitals will be there for that moment and then they'll be demolished. And I'm saying that do also put the building blocks in place for structures that can be utilized beyond COVID-19. I said precisely this to Gauteng. They took it to heart, and then they started putting up filled hospitals in stadiums and places where you store stuff and so forth. But then they also started saying that a percentage, 50% of the hospital capacity that they will build will be with a futuristic approach, where they put in place the building blocks for NHI, where they will put in place more permanent structures that will be utilized post-COVID-19. Because the filled hospitals will cost you money, a couple of millions, in fact. And I'm saying that let's use part of that money to build more permanent structures that can be utilized. I'm glad that from the human resource point of view, as Dr. Mkhize was saying, you've now started to bring, by bringing in more and more capacity. Because it is when we bring in more capacity of these health workers and community workers, and you brought in up to 5,000 of them, that we will be able to manage the spread of this virus. Because the virus is now spreading in communities where our people live, in the rural areas, in the townships. That is where we now need to ramp up the screening. And you are clear proof that the toolbox that we've got to fight this virus is a toolbox that will have great efficacy, because you've added to the toolbox that I spoke about yesterday 2 other key components, which is education and raising awareness. Education and raising awareness amongst our people is so critical, because there are still some amongst our people who think that coronavirus is for people who live in the big cities and the big metros. And coronavirus was brought by people who travel overseas. So it will never get down to people who live as Lalini and rural areas. Now, coronavirus does not know any borders. It does not know rich or poor. It does not know rural or metro or city people. It just spreads. And this is precisely what we are seeing here, also in the Eastern Cape. So it is important that those 5,000 community workers, and we need to have many more, who will be helping us with the screening, who will be helping us in getting to the communities, should be the ones. And we need to raise them just to 10,000. Let us bring them in, train them, and get them to get into the community. This is an investment. It should never be seen as an expenditure. It is an investment, because this virus is going to be with us for a very long time. And all we need to do until we get a vaccine is to manage it down, to also be ready. And I'm particularly happy that you are really truly getting ready for the spikes that are bound to come around August or September in relation to this virus. Yesterday, the other important tool that you've got is communication. Let's communicate as broadly as possible. So if we have this 10 tool toolbox, which is a lockdown, and now we are in a lockdown. But we are going to migrate out of this lockdown. We are now in level 4, we're going to level 3. And beyond level 3, we are finally going to get to level 1. And beyond level 1, we will be, yes, leading our normal lives again. What we need to do is to continue changing our behavior. And how do we do that? After the lockdown levels. And people should never stress. We are going to get out of these levels. We are not committed for life into the levels we are in. And I'll come back to what I announced yesterday. The other area of changing our behavior is social distancing. And we are sitting in a way where we are enhancing social distancing, which is very, very important, so that we're not too close to one another as to be able, as Dr. Mkiza tells me, to spread the virus. And the regular hand washing and washing with sanitizer or soap. And you've enabled me to wash my hands up to 4 times since I came here, and I welcome that. I don't know whether you're doing it a premier because you're demonstrating or showing off to me, but I've been made to wash my hands 4 times. That's great. I hope it's regular behavior and wonderful. And the coughing side, and these are things we must talk about. We must talk about continuously to change the behavior of our people, so that as you're washing your hands again. As we change our behavior, we must be able to make it a part of life now. The coughing side, which I also spoke about, wearing of masks, and I can wear my mask now. and the use of personal protection equipment. And Dr. Mkiza spoke about this. And I'm glad that you also highlighted this. The PPE is extremely important. And this we need to do in respect of our health workers. because those are the workers who are almost laying down their own lives so that they can save all our lives. We need to respect them, we need to protect them, we need to make sure that they have all the tools through which or with which they can do their work. And the frequent cleaning of work environment must happen, but the other important one is the frequent cleaning of public areas where our people live, where our people, walk. We need to ensure that they're disinfected, they're cleaned up, and of course testing, isolation, quarantine, and contact tracing. Contact tracing is an area we need to focus on. There's one professor who was speaking very, very, angrily about what he called our failure to have contact tracing. And contact tracing is going on. If he looks at the graphs that we've got, you'll see that in a number of areas, contact tracing matches exactly the level of the infections. As people get infected, we move around and trace their contacts. And this is precisely what these 5,000 workers that you have employed and rising possibly to 8,000 or 10,000 will need to do. We need to ramp it up as we do screening and the testing. And so that is the 10 toolbox, which you have added education and communication to. Yesterday I announced that we're going to be having consultations with a view of moving to level 3. I must make it clear that we are moving to level 3. Many parts of the country will go to level 3. There are certain areas in the country that are hotspots, which we are going to be talking about to demonstrate precisely the incidence of infections. This country, yes, is bound to go from level 3 as well to level 2 and finally level 1. We are not stuck in level 4. I need to make that very clear. We are now going to migrate to level 3 so that we can loosen up a number of restrictions so that the economy can start operating once again. And we have said from the onset that our purpose is to save lives, but at the same time to save livelihoods, because our people have to live, so therefore the economy is also important. And let me immediately add, we are not the only country in the world that is having to deal with loosening up the lockdowns that many countries have embarked upon around the world. Many countries are now looking very closely at how they can ease the restrictions, and we have decided that we are going to do it in an orderly manner, because we've been advised by scientists that if you do it abruptly, you risk running a reinfection rate that could start happening. Now we are managing that. Now of course, not all of us will agree on the strategic approach that we have taken, but we believe that this is the strategic approach that is appropriate to enable us to save the lives of our people. Now the consultation processes are starting as early as tomorrow. We're going to be meeting, yes, with our social partners at NEDLEC. Thereafter we'll meet with our provinces, and we hope to conclude these consultations very quickly. When I declared the first lockdown, we preceded that process with consultations. We consulted the various partners, including political parties, and spoke to them and said, the infection rate is rising and we need to arrest this and have a lockdown. Everybody agreed. We're doing exactly the same thing as we now moving to level 3. We are going to be going to level 3. And it might even be earlier than the end of the month. We are going to make sure that we consult, and we consult properly and thoroughly. So there's no need to get too excited, to get too hot under the collar. We are doing this as properly as it should be done. And once that consultation process is done, we will then be able to make an announcement, because our direction is to go to level 3. Other areas, as I've said, on the basis of the scientific analysis of how the infection rate is manifesting itself, may well remain at level 4. And that is where the discussions are going to be. Now, with that, I'd like to thank you dearly for the presentations. I think the Eastern Cape has demonstrated, Minister Mkhize, that now they've come to grips with the task that is at hand. Before I came here, I was quite a bit concerned with the rapid rise of the infections, and I kept wondering, why was that so? Now you've demonstrated to us that you've got a clear strategy to deal with it, and I'm sure that we are going to start seeing the leveling of the infections. And with that, I'd like to thank you, and I want to thank you, Premier. You've been doing fantastic work, together with your MECs, health MECs and the other MECs, as well as the officials in our government. You've been really doing good work, and I've now become convinced that you've been focused and you've been committed to making sure that we save lives. But you're also committed to making sure that we save the livelihoods of our people. Your focus on the economic recovery has pleased me quite immensely. So thank you very much. It's good to be here. You want me to show you again? Iqish.
Thank you very much, President.